Hi, I'm Dr. Grace with Smile Shop, and I wanted to do a quick introduction video on the muscles that we work with when we're talking about doing some Botox. There have been a lot of questions about how Botox works and why it works in certain areas and why not in other areas, so I thought this would be a good idea to do this real quick. This is our fabulous model and client, Andrea, who's amazing. So first, let me start off by saying that Botox works to reduce wrinkles that are caused by muscles, and the muscles of facial expression on the face come from lots of different spaces. There's always going to be an origin and an insertion. And when we're talking about muscles of facial expression, rarely do they go from skin to skin or anything like that. There's always usually a bony component and then a skin component. So when that muscle contracts, that's what causes the skin to move, and that's where the wrinkles come from. The wrinkles always go perpendicular to the line action of the muscles, and that's something that you'll see as we draw here, okay? So the first thing, most people come in and they're really concerned right over here with their forehead. So if you lift up your eyebrows for me, you see these right here. So this is the frontalis muscle, and the muscle originates up here. This is the Galea aponeurotica, and it inserts into, usually there's about two bellies of it, this one on one side and one on the other side. And it inserts into the superior, the upper aspect of the eyebrow. Now, there is a limit, so you don't want to go too far. Can you clench your teeth together real quick? So you may have been able to see that, but this right here is where the limit is for Miss Andrea. Some people, so you can see where they clench, and that's where the temporalis muscle attaches right there, and you don't really want to go too far out because that's not going to really do anything for you. So she actually has a nice broad area here. The next area that we like to focus on is this right here. It's a triangular muscle, and it's called the procerus muscle. This is actually the most superior muscle of the nasal muscle group. So the origin is at the highest point of the nasal bone, and it actually attaches upwards this way to the medial forehead. And so when you imagine the function of this procerus muscle is when she contracts that, it actually is a depressor muscle, so it brings everything here down. The function of this frontalis, the big frontalis muscle up top, actually is to keep everything up. So the frontalis muscle is an elevator muscle, and the procerus is a depressor muscle. So the reason why that's important is because when you elevate these, or when you use the Botox or any other neuromodulator up in this forehead area, you need to be careful not to go too far down. If you go too far down, it seeps into the depressor muscles, and then the action that you're trying to avoid is what then starts to happen. So that's where sometimes you can get that droopy eyelid, or there's too much of a lift, and those things are correctable knowing the anatomy that we know. All right, the next area is these corrugator muscles, and these muscles are also depressor muscles, and it starts at the superciliary arch, and it inserts into the skin of the eyebrow. So this goes up this way. She looks great, doesn't she? But this is also an area, can you make that angry face? So you can kind of see where it pulls, and this is the farthest limit. Everybody has a very unique endpoint for these corrugator muscles. Some people, if you look at Andrea, hers is very closed in this way. That's about as far as that muscle needs to go, that muscle attaches. There's nothing past here. So you don't want to go too far back this way, because then again, you might get a drop. But when we place some Botox here, these are the muscles, the procerus and the corrugator muscles, that cause that 11s line to occur. So when you're not happy with these 11s, it's really this muscle group right here. The other spot that most people do the Botox for are these crow's feet, and smile big. So you can kind of see these little lines right here. Now this is the orbicularis oculi muscle, and this is a very interesting rounded muscle. I'll only draw on one side of the face because then she's gonna look all crazy. But basically it starts in with this medial, the medial aspect of the eye, and it also originates from the lacrimal bone, and it basically goes all around. It legitimately goes all around the eye, and it inserts into the skin of the eye, right? So what happens is that it's kind of like a sphincter that when you contract it, it closes and then opens and closes. So the wrinkles that form are really along this way. So if you look at it being perpendicular, this is what I mean. The muscle group right on the side is up and down right here, but the wrinkles will form like at a T. So that's why when people say that they want to hit up down under here, this is not really because of the action of the muscle. It's really the action, just the fact that we lose collagen and skin volume, and a little bit of fat that's put there. So that's not an area that we really mess with Botox. Now these are the 3 common spots that Botox is used for. I would say that sometimes you can get these little bunny lines in here, and that muscle is another part of the nasal muscle group. It's a very thin muscle line that comes straight from this medial aspect of the nose all the way down, and that's the levator labiae superioris allicate nasal muscle. It's a really big name. I just know it as the bunny nose. So when you kind of scrunch up your nose, some people get this little bit right here. Again though, this whole area though is very prominent with lots of muscle groups. So some are superficial to the others, some are on top, some are underneath. So you kind of have to know where they are if you're triggering specific muscles to stop certain wrinkles. Usually the upper face is where the Botox is best effective. Sometimes we will use it for the lower half of the mouth, or lower half of the face, sometimes around the mouth. There is a muscle right here called the depressor anguli ori that kind of pulls this down a little bit. That's not going to get rid of this wrinkle or fold. What it does is if you have a natural like downturn of the lip that you're trying to go up some or just neutralize it, that's another area that you can hit up with some Botox. Other spots here is this mentalis muscle that's really strong. Sometimes you'll get this really strong pull right here. But generally speaking, when it comes to lines and wrinkles, top half Botox, and this is why. So if you have any questions or concerns, please let us know.